Good evening and welcome to the program. My name is Dr. Reed Tuckson and I am a co-founder of the Black Coalition Against COVID, one of the many organizations that has been doing work trying to protect this nation from the ravages of this pandemic. Welcome to our virtual town hall hosted by NFL Alumni Carolinas chapter and done in collaboration with the wonderful people at the North Carolina Department of Health and Human Services. Our goal this evening is to help you get your questions answered about COVID-19, and in particular, to have your questions answered about the vaccine and other preventive measures. And today, we know that there was an important announcement about vaccines that we will get to during our program. I am so thrilled to introduce our panelists, beginning with Dr. Elizabeth Cuervo-Tilson. Dr. Tilson is the State Health Director and the Chief Medical Officer for the North Carolina Department of Health and Human Services. We're also joined by Dr. Tom Holland. He is an Associate Professor of Infectious Diseases, just the kind of expertise we need tonight, at the Duke University School of Medicine. And we're also very excited to welcome Dr. Brian Shackelford. He practices general internal medicine, and he is a representative from the Old North State Medical Society. But this program wouldn't be special if it weren't for our athletes, our former NFL players. And we're so thankful that Adrian Morrell is here, former running back for the New York Jets and the Arizona Cardinals. But tonight he is here because he's the president of the NFL Alumni Carolinas chapter. And we're also pleased that Eugene Robinson, many of us have seen him play often as well, former safety for the Carolina Panthers and the Seattle Seahawks, three-time Pro Bowler and a Super Bowl champion. Well, to get us started on this conversation tonight, we want to make sure that all of you are really clear about where we are in this pandemic. There are a lot of people who are beginning to think that everything is over and they can just go about without worrying about anything. We'll find out whether or not that is true. And there are many of you who may still be wrestling with the decision about whether to get themselves and or their families, and particularly their children, vaccinated. And we'll get to that tonight as well. By the way, please submit your questions that you can in the chat function, and we'll be paying attention to those and trying to answer those as the program goes forward. Well, let me begin with Adrian Morrell. Adrian, you are the president of the Carolinas Alumni Chapter, as I mentioned. Tell us a little bit about what is the NFL Alumni and why are you conducting this campaign that this show tonight is a major part of?
Well, thank you. I appreciate that, Tuckson. The NFL Alumni is an independent nonprofit association for retired NFL players. The NFL Alumni, we're devoted to our own community as well as the people in our community as well. So last year, we launched a partnership with the CDC to help educate Americans about COVID-19 vaccines. We encourage everyone to try to talk to their doctors, get the facts. So that's really one of the reasons why we're here, to just help get the word out and so folks can get the facts about the vaccine.
That's terrific. And Eugene, let me make sure that I understand. Why would you take your precious time? You've got many things going in your life. Why did you get involved in the NFL Alumni campaign, and why are you so involved in this issue that we're here tonight to talk about?
Well, the vaccine is crucial. I mean, if you remember, if we go back 2 years when COVID was only in California, it spread like wildfire across the country. And in the wake of all that wildfire across the country, we were just doing social distancing, cleaning your hands. We had a mask. We were separated. We were just doing that. People couldn't wait to get the vaccine. And there was a number of people that died during that time. Well, guess what? My cousin got COVID. He got it from a group home. He goes in the ICU. He gives it to his mom. While he's in the ICU, his mom dies. So my aunt passed away. It became very, very real. And so when COVID is afar and it doesn't touch you, you don't see it and you don't pay attention to it as much, and you can easily get a lot of misinformation. But when it touches your life, you get invested, fully invested. And that means a whole bunch of it. It just changed the landscape of not only my family, but what do I do? And how do I handle that with my mother-in-law who lives with me? How do I handle that with someone who's an older person living with me? I'm a high school coach. I had to become vaccinated because if I don't, I put so many people at risk, not only myself, but so many other people when I had COVID already touched my family. So it was easy when Adrian said, hey, man, Gene, I need you to go ahead and get involved. Oh, Adrian, I'm in. I'm all in, dude. No doubt, because we need to spread the word and we need to go ahead and clear up a lot of misinformation. And this is what this town hall is about. And that's the reason why I'm involved.
Gene, let me just really echo in and turn to Adrian and ask him the same question as to, why he's in it. But Gene, you said something very important that a lot of people don't get, and I need to highlight it. And that is, you were concerned about making other people ill. So much of this conversation in America, Gene, I think you'll agree with me, has been about me. It's all about me, me. What you focused in on, you were concerned about whether or not you would make someone else sick, particularly these vulnerable high school children that you are working with.
Absolutely. COVID does not care who you are. It seems to be a disease of opportunity, a virus of opportunity, and it affects everyone. It affects absolutely everyone. So I'm a high school wrestling coach. Well, I had to pull away from wrestling, being a wrestling coach, because I can't afford to get my kids sick. I can't afford for them to get me sick. And so it was really, you were doing this self-quarantining thing. And so I was aching for a vaccination. I was aching for something to go ahead and to protect and to mitigate against at least dying, at least something like that could be really devastating. And so from that standpoint, it became a personal choice, but it became, for me and my family, the right choice.
Adrian,
the right choice.
Adrian, many people and high-profile athletes have, several of them have made the decision not to get vaccinated and have been very public about that. Many other athletes have been nervous about coming forward, worried about the backlash that they may get from those who are the purveyors of misinformation and who have other political or whatever agendas. Why, Adrian, have you taken this on personally?
Well, personally, it affected my family as well. We had, I'm one of my great uncles. They went to a family gathering, and so happened somebody got sick. One of the family members gotten sick, and it just went through our whole family. And unfortunately, he passed from COVID. So when we had an opportunity to get our vaccination, the facts were out there to the point where I was willing to myself get the vaccination as well as vaccinate our family. And they were the same way. They wanted to get vaccinated because, as you know, it was a scary time in 1 to 2 years ago.
Wow. Well, thank you for what you're doing. Let me turn to Dr. Tilson. Dr. Tilson, being the state health director and the chief medical officer for the North Carolina Department of Health and Human Services, I personally want to thank you. So many of our public health leaders on the front lines have been attacked. Their homes invaded. They've been called terrible names in public. And it's just one of the saddest things I've ever seen in my life. So on behalf of a grateful nation and having you represent all those dedicated public health workers, thank you, Dr. Tilson, for what you are doing every day. In terms of, as we look at, one of the things that the CDC has taught us is that as important as national data is, the really important data is what's happening locally, where we live. Can you help us as we are approaching almost 1 million deaths in the United States from this? It's hard to imagine, Dr. Tilson, as I even say that out loud. We are approaching 1 million deaths from this pandemic. Tell us what's going on in North Carolina. Is this pandemic over?
Well, first off, I want to thank you for your kind and gracious words. They are very appreciated, and I am grateful for that. I'm also very grateful for all the efforts of the NFL alumni and getting us involved in this partnership. It is such incredible work, and thank you all for allowing us to partner with you on this. to get to your question, so in North Carolina, much like the rest of the nation, thankfully, we're in a very different place in this pandemic than we were. Just as we're being articulated in the beginning, we didn't really know about this virus. It was brand new. We were learning more and more, and we didn't have the tools that we needed to protect our people. We're in a very different place now. We know now we're still learning, and we will continue to learn. This virus is a very smart virus. We'll continue to learn, but we know a lot more about the virus, and we have so many more tools now. We have our vaccines and boosters available. We have tests that are available. We have treatment that's available, and we have personal protective equipment that's available. So we're in a very, very different place with our tools. And thankfully, because of all of our collective actions and what we have done to protect ourselves and our loved ones and others, we're also in a different place in terms of our viral spread. So when we look at all of our key indicators, and we just recently switched them last week, but we look at rates of transmission, rates of hospitalizations, or ICU, and some early indicators we have wastewater surveillance and the surveillance of people coming to the emergency department. All of our metrics are down. Now, they're not none. We still have virus circulating around. It still is an equal opportunity virus. But thankfully, our levels are down, and we have enough of our protective tools around us that we're in a very, very different situation now, which means this is the time that we want to be sure people have the information that they need, know they have access to all those tools they need to be able to lower their risk and the risk of their loved ones. So these are perfect opportunities right now that people can have all those questions answered so they can make that individual risk assessment and think about what else they can do to protect themselves.
A quick answer, very shortly, short answer on how worried are you about this new variant called the BA2 variant that's been circulating around Europe and now present in the United States?
Yeah, so the one thing we know about this virus is that it has variants all the time and will continue to have variants. What we've seen in Europe and the United Kingdom is that with the emergence of this BA2, the Omicron stealth, they did see an increase in cases and hospitalizations. So far in the United States, we've seen about 30% of what's circulating is this new variant. So far, we haven't seen a bump in cases and hospitalizations yet, but often we follow Europe, and there's about a 3-week to month delay. So it's good we haven't seen it yet, but we are still cautiously looking. And we want to be sure that people have the tools that they need to protect themselves if this variant becomes more of an issue than we're seeing so far.
Well, as I turn to Dr. Holland, I do want to remind something that Gene said a moment ago as he watched that spread of the disease moving from one part of the country to the other. The audience needs to be well aware that in the New England states, now more than half of all of the new cases of COVID are from the new variant B2A. It is extremely easy for that to be transmitted. But as Dr. Tilson has said, what we don't know yet is how severe the infection will be. But we need to be very attentive to that. And so please do that. Dr. Holland, in addition to your conducting significant research related to COVID, you have been in the hospital leading clinical teams caring for people. Talk to us very briefly about what that's been like and what has been the difference between what you have seen between those who are vaccinated and those who are unvaccinated.
Yeah, thanks. I think Dr. Tilson hit on some of this at the beginning. This has always been a pandemic of the unvaccinated as far as the people that have severe disease and are in the hospital. Of course, we were all unvaccinated for the first year, right? We went the first year and didn't have vaccines. We had some of the things that Eugene talked about and others. We could socially distance, we could wear masks, but everyone who was in the hospital was unvaccinated then. Unfortunately, that's remained the case. So the vaccines really work. They're not perfect against protecting from getting mild COVID, but they really work to keep people out of the hospital and to keep people from dying from COVID. So even as vaccines have become widely available in the last year, the folks that I take care of in the hospital, they're unvaccinated. The people who don't survive this illness are unvaccinated.
This is a very important distinction that you've made, and I want to make sure we draw a very bright light around that. What you have said is that the purpose, if I understood you, and I want you to amplify it in a moment here, the purpose of these vaccines is to keep people from becoming terribly ill, being hospitalized, and dying. and that's what's really important. Some people who are vaccinated will encounter the disease and become mildly ill, but the purpose of the vaccine, as I understand your point, is to keep you from being hospitalized or dying. And it seems to be doing a very good job. What's your comment on that?
Yeah, I think that's well put. You know, I think in the very early days of the pandemic, we had really high hopes, probably unrealistic hopes, that there would be a vaccine that could keep, that could stop transmission, that could keep anybody from getting sick. That's not been the reality. But what the vaccines have been good at from day one and continue to be good at, like you said, is to protect people from dying, protect people from getting severely ill, winding up in the hospital. We do see breakthrough infections. Probably some of the people on this call have one. I have had one after one of my kids came home from school with COVID. But I was protected by vaccination, and so I didn't wind up in the unit that I helped run for COVID because of that.
Terrific, Dr. Shackelford. Many people in the audience right this moment listening to this conversation are still struggling about making the decision to become vaccinated themselves, or if they're parents, they may be having to struggle with the decision about having their families vaccinated. What are some of the questions and concerns that your patients most frequently ask you, and what are you telling them about these high priority questions on their mind?
Thank you, Dr. Tuckson. Honestly, I'm getting a lot of questions in regards to, first, since we were given the at-home test, they're a blessing in disguise, but also, especially with Omicron, and my concern for this BA.2 variant is, as it is a stealth variant, I'm hearing a lot of issues with negative rapids, but still having symptoms. I've been exposed. There was a high.
I'm sorry, you might want to explain what negative rapids means.
Yes, sir. Not a problem at all. So the rapid, it's an antigen test. So the swab that you might do of your nair, you place it in a reagent, which is pretty much, I hate to say it, but COVID juice is the easiest way to explain it. The test runs for about 15 minutes. If you are positive on the antigen test, what is it saying? You likely have had symptomatic, or you have symptomatic disease. It is not a good test to say that you are negative for COVID, but it is a great way to say you have COVID and you have symptomatic disease. What I am seeing a lot of is patients who are negative on a rapid test, or may even have slight symptoms, mild symptoms, negative on a rapid with high risk exposures, are asking me, hey, does this mean I'm good? I believe that those tests were great to be able to take home and to utilize, but no, it doesn't mean that you're good. If you've had that high risk exposure, or God forbid that you have some symptoms and you're negative on that rapid test, I'm still telling my patients that you need to get PCR tests. It's more confirmative. It is the gold standard in regards to ruling out, making sure you're actually negative, and it will confirm that you are positive as well. A second question that I'm really getting right now is about the boosters. Like, I'm fully vaccinated. Do I really need to get these boosters? I mean, I'm afraid that this is going to turn into a yearly thing. Is this the new wave? Am I going to have to get booster after booster after booster? Since I do a little bit of outpatient as well as some inpatient, I try to tell people what I am seeing, because data really just is the answer to everything. I'm still seeing a difference between those who are up to date with their vaccination profile, fully boosted, compared to even those, especially with Omicron, that only had their 2 shots. Or fully vaccinated, hadn't been boosted. There's a little bit of a discrepancy in regards to some of the symptom profile. So as we do prepare for what I pray is not an onslaught of BA.2, but if that were to occur, I'm still telling patients to make sure that they are up to date, fully vaccinated, boosted, especially even the young ones, the children. 5 and up right now, anyone who is available to get those vaccines, available to get those boosters, 12 and up, to make sure that they are fully vaccinated and boosted.
Dr. Holland, from your position at the health department, what is your comment on boosters? How are we doing, and why are they so important?
Yeah, I think so. From I think like Dr. Shackelford was saying as well, our immunity wanes over time. So if you were vaccinated last year, if you were vaccinated 6 months ago, 8 months ago, then your protection against another infection or getting infected with the Omicron variant is started to wane and started to wear off. And so boosters they've been life-saving. They were life-saving. People who had a booster before the first Omicron surge, the one we've just come out of, hit, were again less likely to be in the hospital, less likely to die. And so the boosters have worked. And we would expect that would continue to be the case. It's hard to know what the next variant is. Is it this BA2? Is that, if there's one thing that we've learned from COVID, it's a little bit of humility, right? Like, I don't know what's coming, and nobody knows exactly what's coming. We can look at Europe for clues. We can look at the Northeast for clues. It may be that variant. It may be a different variant, but something's coming. And and so the best way to be ready for that is to have that immunity that's provided right now by booster shots.
Well, Dr. Tilson, I have been very concerned by the data that I've seen of the fall off between those who have gotten their 2 doses of the initial series of Moderna or 1 dose of J&J. Those numbers, we did get those numbers up pretty well, but all of a sudden the booster numbers have just not been anywhere near what they need to be. What is your perspective on this, and what are you telling all the people that are living in the Carolinas?
Thank you for that question. So just to echo what the other physicians said, that having that booster is incredibly important in strengthening that protection, especially against severe hospitalization, illness, and death. That being up to date, having that initial series and that booster is critically important. So we're working very, very hard at getting that booster up, especially amongst those people who have higher risk for severe illness in general. So people over 65, people with underlying medical conditions, really trying to encourage that. The other work in North Carolina I'm very proud of is our equity work, making sure that our vaccines are equitably distributed across all of our population, everybody in North Carolina, and making sure that we are really narrowing or eliminating that equity gap. So we're doing a lot of work in making sure that our vaccines and boosters are easily available to everybody and decreasing those barriers. But we're seeing over and over and over again in our data, in our hospitalizations, in our deaths, that booster is really important to strengthen that protection against COVID.
And there was just for the audience's sake, there was a very important announcement today around the recommendation for another booster dose for those who are 50 or over. So if you've already had one, if you're over 50, you need to be consulting with your advisors, your health advisors, as to whether or not you should go and get another round of boosters. They're very important. But I want to turn now to Gene. Gene, you have a question I know that you wanted to ask about the variants.
Yeah, so with the variants, we talked Delta, Omicron, and now this BA, you said BA2. So does that mean when you have a new variant come on, do the other variants take a back seat, or do they still continue to exist and still infect people? So how does that work when a new variant comes on the scene?
I'm happy to tackle that unless somebody else wants to jump in. So I have to say, it's amazing to watch these variants take hold. It's like seeing evolution in a rapid cycle. So these viruses are very good at mutating, and they mutate, and the ones that are more transmissible take over. They can outcompete the other ones. So it's pretty amazing to see this in real time. So they outcompete the viruses and they're gone. So we don't see really any Delta anymore. It is gone. It is 100% Omicron now. And amongst the Omicron, it's about 30% of this sub-Omicron, this BA2. But the other ones go away and these new ones outcompete. It's pretty remarkable to see and how quickly that happens. And then the concern is, I think what we know is the ones that'll take over are the ones that are more transmissible. They can outcompete. And then the big questions are they going to cause more severe illness? Are our vaccines going to be effective against them? Are our treatments going to be effective against them? And so we have to adjust with those as well.
Dr. Shackelford and then Dr. Holland, we have a question from the audience. And Dr. Shackelford, let me start with you. We have talked about the consequences of this disease as being either making people ill, making people very ill and needing to be hospitalized, or people dying. There's another impact of this disease, which we're learning more and more about every day, and that's called long COVID. And so somebody wants to understand, what is it that happens over the long term for people who have been infected with this virus?
Yes, sir. So to that audience member who does want to know exactly what long COVID is, initially, we didn't know anything about long COVID because COVID was a novel virus. We just knew mortality rates But as we've kind of been able to compile 2 years worth of evidence and 2 years worth of cases of COVID, we have seen that roughly 1 out of every 3 persons has a course of COVID where inflammatory changes cause long-term side effects. And I mean, these side effects are months and months, and some people are status post a year or a year down the line still having those side effects. And just to give a few of them, we know a lot of people have the acute respiratory failure where they end up needing to be intubated or they're on a breathing machine. A lot of people are able to come off the breathing machine, but their breathing doesn't get back to normal. It takes them a long time. There are a lot of people who didn't have oxygen requirements prior to COVID, but 2 months, 3 months, 4 months down the line are still having that oxygen requirement because their lungs haven't remodeled back to what they were prior to them having COVID. A lot of people have what's called encephalopathy, or that they're having some brain fog. Some people have, honestly, they have COVID, and that kind of pseudo dementia or that encephalopathy doesn't seem to go away. That encephalopathic brain pattern where they aren't able to kind of think the same, they aren't able to mentate, or they really aren't able to answer questions appropriately. They aren't able to do their activities of daily living, their independent activities of daily living, like balancing their checkbook, things like remembering where to go throughout the day. That has persisted in some people for months and months. Other people have had severe debility and weakness from being in the hospital, being in the ICU, just being sick for so long that they're no longer able to do those activities of daily living, not able to walk like they were prior to. There's also there's some axonal neuropathy from COVID, where people are having numbness and tingling and unable to kind of feel their hands and feet the same way after COVID. And that's honestly not going away for some people as well. Some people also, and this is my last point because I know I'm kind of waxing and waning a little bit, but some people have actually lost their taste or senses of taste and smell and still haven't recovered that after nearly a year. So that's just a small portion and picture of what long COVID looks like.
No, I would disagree with you, brother, that you have not waxed and waned. I think you've laid out an extraordinary array of issues, and there are, in fact, more. Dr. Holland, I don't know whether you want to augment that with some of the other long-term consequences that we are seeing, but I think this is important. It is very important for people to understand this is not like the flu. This is a totally different illness here, and you can get over the flu and be back to normal. With this condition, so many people are struggling with other issues in relationship to what this, from their initial exposure. Dr. Holland, what are you seeing in addition?
I think the thing I would add to that was a good summary of the things that people experience with long COVID. Part of it is that one of the things that worries me is that long COVID can happen after pretty mild illness, right? So people that get severely ill, they're more likely to have long-term symptoms that take longer to recover. But it can happen to folks who have mild illness, don't feel so sick, have a little bit of a cold, just feel a little bit unwell, and then they develop this fatigue or brain fog or ongoing symptoms. That to me is one of the most powerful reasons why I would want somebody who's young and healthy to be vaccinated to prevent that from happening, right? When I look at my kids, I've got an 18-year-old son, a 16-year-old son, a 13-year-old daughter. They're likely to do okay if they get COVID, but the chance that they could get long COVID, it does frighten me as a dad or somebody that takes care of patients, and that's largely preventable by vaccination as well. So I think that's an important point.
One of the things that I have been concerned about, in addition to these excellent comments, has been the data that is now being shown of the changes in the brain, which we can now see on MRI studies. We've been able to see actual changes in the brain. We're also seeing some significant effects on the heart in addition to the lungs. And so these are things that are going to be very important to monitor. And I would say for those of you that are worried about paying for medical bills, just start thinking about what it's going to mean for all of those thousands and thousands of people who will be suffering with the consequences of this disease for a very long time and will need medical intervention. There is an economic price that you're going to pay for that, which is very important. Dr. Tilson, we have a question in the audience, from the audience, that gets at the thought about vaccines can sometimes perhaps have side effects. And so what this questioner seems to want to understand a little bit more about is what might those side effects be, and how do we weigh the risk-benefit ratio of the side effects of the vaccine with the benefit of the vaccine. And while she is answering that question, we continue to remind our audience that the NFL Alumni Health Organization wants to hear from you. So keep sending in your questions. This is your program. Dr. Tilson.
Thank you. First, I wanted to add one other thing about the long-term consequences of COVID, and then we'll absolutely get to the side effects of vaccine. The other data that we're seeing more and more, and I'm a pediatrician by training, and I'm really pay a lot of attention to thinking about our children and vaccines for our children. And one of the data that we are seeing emerging more and more is increasing rates of diabetes in children after having COVID. So I'm really worried about that and paying attention to that. So we don't think about that as long COVID, but another long-term complication of COVID may well be new onset diabetes in our children specifically. So I want to be sure that parents in the crowd are aware of that potential risk as well. Now, when we talk about the side effects for vaccines, one of the great things about this COVID vaccine campaign and where we are is the amount of data, safety surveillance, information we have on these vaccines. We have the most robust safety surveillance system ever that we've had in the country, and hundreds of millions of vaccines that are informing those data systems. And what has showed us over and over and over again that these vaccines are incredibly safe, and these vaccines are very effective, especially in preventing severe illness and death. Now, people likely will have some temporary side effects, having maybe their arm is sore after the vaccine, having a headache, maybe having some fevers, being tired, having chills, but just for a couple days. Those are temporary side effects, go away for the couple days. When we look at the risk benefit of the vaccines and the actual complications of the disease, that risk benefit is always in favor of the vaccines. That is much, much, much lower risk to have a vaccine than have the actual disease. So incredibly safe. There are very, very, very rare events, and people may be aware of that, very rare events of things like what we call myocarditis, inflammation of the heart. Some very rare effects of clots with Johnson & Johnson. But just as you pointed out, we know that myocarditis is a side effect of COVID-19, the disease itself, and you are far more likely to have those lung issues with the disease than with the vaccine. And I'm so comfortable with the amount of vaccine safety data and surveillance that we have in this country that these vaccines are exceedingly safe.
I really appreciate your answer to this question. I know from, looking and sampling the misinformation that's all over the internet and social media, that you get folks all revved up about worrying about various side effects of the vaccine and believing that people don't want to talk about them. At the end of the day, tens of millions of people all around the world have been getting these vaccines now for a year. And we have extraordinary amounts of data over and over again about the safety profile. And so I would hope that people would not take a couple of anecdotal stories or a piece here or an unfortunate event there and say, well, that's the reason why I'm not going to get vaccinated, without thinking about 1 million people close to that just dying in the United States alone. And as you have indicated, Dr. Tilson, and this is very important for an alert and aware audience to appreciate, the kinds of adverse consequences that people like to bring up, like myocarditis, are much, much more likely to happen if you get the disease, not the vaccine. And so we've got to put these risk-benefit ratios into perspective. There is a very big, major question that a member of our audience has, and I want to make sure that we get right to it, and that is the question of masks. And let me start with Dr. Holland and then Dr. Shackelford and get your advice, and then come back to Dr. Tilson. And that is this. And the reason why I want to start with Dr. Holland and Dr. Shackelford is because the issue of wearing masks has become so doggone politicized. It's like, it seems to be that if you say wear a mask or don't wear a mask, you're in the middle of politics as opposed to science and health. And so I think we need to be very clear. Dr. Holland, first with you, and then Dr. Shackelford, what are you advising your patients about wearing masks today?
Yeah, it's a great question, and you're right. It has become political in a way that's unfortunate, right? Because it's a health decision that doesn't, it should cut across political lines. It shouldn't be a reflection of political affiliation. Certainly, we're in a better spot with COVID cases now than we were a few months ago, for sure. And so, I think this changes over time, and the other panelists may have a different opinion about this. I think right now, if you're in North Carolina, you're in an outdoor place that's well ventilated, you don't need to be in a mask. If you're around people that you know their vaccination status, family, friends, small gatherings, I don't think you need to be masked. If you are, I still wear a mask to go to the grocery store. I would wear a mask if I was in a crowd where I don't know, the people and their vaccination status around me. And certainly at work, every time I walk in the doors of the hospital, I'm in a mask. We're still wearing it in high risk settings like that. But we're able to be mask free more now than we were a few months ago, I think, safely. And that may change, right? If we get caught in another surge, then this has to be dynamic.
And Dr. Shackelford.
Yes, I'm going to second what Dr. Holland was saying. I'm telling my patients, if you're around family, everyone that you know their vaccination status, and you're not in large groups or high risk setting or high risk number of people, feel free, especially even outside as well, feel free not to wear your mask. But if you're in those high risk activities, like I wouldn't tell anybody to go to the Charlotte Hornets game and not be masked. So I'm telling people, if they're going around people that they don't know their vaccination status, going in large crowds, to make sure that they are masked. I just think it's best for safety. I can only practice what I preach. So that's what I'm doing now.
And Dr. Tilson, let me get very specific in terms of the advice to our audience from your office. We know that the CDC has now come forward and said that there are some criteria about of the data and the numbers of community spread. And that when you see numbers in community spread of certain categories, that ought to be a trigger for extra vigilance. Would you please tell us what the category, what people should go to your website at the Department of Health and see the community transmission? What should they be looking for specifically?
That's such a great question, because we want to make sure all the data is readily available so people can absolutely assess what is going on in North Carolina, and that then can help inform their decisions. The CDC changed to community COVID levels, and that if you are green or yellow, then universal masking, especially for low-risk people, is not necessarily the most important, but high-risk people and in high-risk settings still is suggested. People in red, when you see a level of red, then it is recommended universal masking. Thankfully, right now, all North Carolina, 100 counties in North Carolina are green, which is great. So overall lower risk now, but people do want to look at that website and be able to see if we start ticking up and see more and more transition, then they can make that decision of, all right, it is now a better time for me to wear a mask because I know there's more COVID out there and I can protect myself more.
What is the address of your website that you want every single person on this listening to this to go to for this kind of information?
That's right. The easiest is our main website, which is just www.dhhs.gov. We have a spiraling piece on our landing page. You can go right to our COVID page, and then we have our dashboard right front and center. So it's very easy to navigate from our main page.
Adrian, you have a question, please, sir.
Yes, no, my question to all the doctors here, what do you guys see for the future? Is it going to be every 6 months that we're getting booster shots? I'm in that age group where they're recommending the second booster. What are you guys thinking?
Yeah, I'll take the first swing at that. I would go back to maybe a broken record here, but a little bit of humility, a lot of humility about what's going to come next with this virus. So the one honest answer is that I don't know for sure, and I don't think anybody does. My best guess, and others may disagree, is that it's going to wind up similar to flu vaccination, where there's an annual booster, at least in the medium term. And so I do think repeat boosters at intervals that are not totally clear right now, but likely to be somewhere around annual boosters seems like the most likely outcome to me.
Okay.
If the other docs see it the same.
Good. You have Dr. Shackelford and then Dr. Tilson.
Yeah, I am of the vein of thought that this is at least going to be something that we're going to need to get every year. I do liken it to potentially our new flu shot, even though we're not saying this is the flu, but on the same kind of interval in regards to timing. I also second what Dr. Holland said. We have been humbled by this virus multiple times. So as this virus continues to show us that it is one of the smartest viruses in the history of the world, we will continue to adapt as need be. But I would agree with at least every year.
And Dr. Tilson.
Yeah, certainly agree with my colleagues, and certainly the humility aspect. But we'll couple the humility with continuing to look at the data and the trends and continue to make recommendations as we learn more, that we'll be continuing to learn on that. I do expect that this will start being circulating respiratory virus like our other ones, and I would also not be surprised if it ends up being an annual booster, but we don't know, and we'll keep looking at the data to inform that.
Let me just make sure on this point of humility that we are very clear with the audience. Many people on social media and conversations get very frustrated when the guidance from health experts and physicians changes or modifies. And I think what is important that we need to understand is that first and foremost, our scientific knowledge and the evidence basis upon which we make our decisions does increase and improve day after day. And so we learn more. Secondly, the virus is changing. The conditions on the ground change. And so I think we do need to, as we talk about being humble, we need to realize, and the audience and our nation needs to realize, that if science changes, then the people communicating science have to also modify. If the virus goes through a mutation and we have new challenges, then we have to come forward with that. Eugene, you had a question I want to sneak in real quick before we end. And would you get your last question in, please, sir?
Yeah, I was raising my hand. I want this question to go out there. For those who are watching who may be apprehensive about, getting a vaccine, and this is to the doctors, don't you all make an oath to do no harm? And don't that oath governs you whenever that you're doing research on vaccination or collecting data or everything that you do? Isn't it filtered through that?
Beautiful question. Dr. Shackelford.
So yes, we do take the Hippocratic Oath. It does tell us first to do no harm. So this vaccine is probably the only vaccine that I have known to mirror the United States population. It's one of the first trials, honestly, that has taken into account what the United States looks like holistically. It is one of the most diverse trials that I have seen published. The risk-benefit ratio is always one to be weighed. And as Dr. Tilson was saying earlier, the benefits of the vaccine versus the risk, the benefits far outweigh the risk. We know after 2 years what some of the side effects of the vaccine are. We also know after 2 years what the consequences of COVID are. So it is our oath to do no harm. And in our oath, we believe that getting vaccinated and also getting your boosters is that way that we convey the best care and to make sure that you aren't being harmed.
I'm going to just tee up our panelists, the physician panelists, to know that we're going to do a quick lightning round in just a moment. And I'm going to give each of you a chance in less than a minute to make the final point that you want to make before we end at 7:45. But on this, this has been an important point, and it's one that frustrates me a bit, I must say, as a physician, when you have all of America's health expertise, every American professional society, every hospital association, all nursing associations, all of us are on the same page supporting the right recommendations and guidance from the CDC and the science. And yet we can have some people with no degree who have never studied anything get online, spout off all kinds of unsubstantiated nonsense, and drive the train off a cliff. It is very frustrating. We have studied these issues our entire professional lives, and hopefully that will have some guidance and some sway with the audience. I want to quickly mention one question in the chat that gets at the issue of someone who I'm very sad to hear about has had long COVID. He spent 14 days in an ICU, and he's suffering from brain fog, and now it's got a number of issues. And what he wants to know is, will the booster help take away some of his symptoms. And unfortunately, no, it won't. You need to be boosted on the front end, not the back end. That being said, there are new and exciting drugs that we are now seeing to be effective if taken early in the course of the disease that can help. Of course, that does not mitigate the importance of preventing the disease in the first place. But there are some things, unfortunately, we will not have time to talk about it tonight. But let's remember, and I know that that we have, I could only imagine the frustration of Dr. Holland as he's in the hospital taking care of people at the bedside who refuse to get vaccinated and now are going, oh, by the way, can I get my vaccine now? It's too late then. Get it done now. But I'm going to go and do the quick lightning round and start with Dr. Holland, then Dr. Shackelford, and then I'll give Dr. Tilson the last word. 30 seconds. What's the one thing that you want to make sure the audience hears from you?
I think one thing I want to bring up is to shift from humility to empathy as well. People are trying to make the right decision for themselves and the people they love. And so if you're talking to somebody who has not made a decision to get vaccinated, use some empathy to understand why they've come to that, offer what you know, offer the resources that you've heard about tonight, and approach those conversations with empathy. It's hard to take care of those folks in the hospital who can come in and say, gosh, I just wish I'd gotten back. I wish I'd had better information. I wish I'd done this differently. We can help people on the front end.
Dr. Shackelford?
If I were to sum things up really quickly, there's a statement that says men lie, women lie, but the numbers don't lie. We're at a point in this pandemic where the numbers really tell us that our vaccines are safe, our boosters are safe, they prevent terrible disease. And with that empathy that Dr. Holland was talking about, feel free to have those conversations with your loved ones or your friends who haven't been vaccinated and try to come to an understanding, like Dr. Holland was saying, of why not, and then give them the numbers and the facts and then let them decide.
And Dr. Tilson, before you make your last quick 20-second comment, I do want to let the audience know that they should go to your website and look up and learn about your Spring into Summer campaign, which I think is going to be a very important initiative for the people of North Carolina. But what's your last thoughts?
I want to answer Mr. Robinson. It's not just an oath. It is our mission. It is our fiber of taking care of people. I am a mother. I am a wife. And I am a physician, and I've dedicated my life to the health and safety and well-being of our public. And every day we all come to work to say, how can we save lives in North Carolina? And I have absolutely no hesitation whatsoever to say vaccine and boosting is the way that we can save lives. And that's what we are all completely devoted to, is taking care of people and saving lives. It may be our family members, it may be people who have never met, but every day it's not just our oath, it is what's in our fiber, it's taking care of people.
What a wonderful way to end our conversation. Let me thank the CDC for their support and for Janet Marcia-Broda, who is the extraordinary leader of the NFL Alumni Association Health. And I really, really want to have to take my hat off to two incredible people who are in our community. And we are so blessed to have them. Adrian Morrell and Eugene Robinson, you are the role model examples of what we need from our athletes, our celebrities. God, thank you for what you all are doing. Don't get tired. Let's keep at it. Let's have a healthy Carolinas. Everyone, have a good evening. Get vaccinated. That's the message today.
Indeed.
Indeed. Let's do it. All right.
Thank you,
everybody.
You guys have been great. Thank you so much.
Thank you very much, doctors. Thank you all, doctors. Thank you very much, sir. Thank you, madam. Thank you.
Thank you.
Thank you.